Radiography and imaging systems are again another core technology in digital dentistry. So we have the digital radiography and imaging systems. Okay, so now we have, I don't know how many of us that have actually used digital x-rays. If you use digital x-rays, you can see the comparison between digital x-ray and the traditional x-ray. I remember those days in dental school when they were teaching us x-ray as beginners. Then you come, if you go to the x-ray unit, you see all of those things hanging up there, all of those exposures that are trying to dry off and being produced and all of that. But digital x-rays now eliminate all of those practices that we don't have to do those manually. Now we can actually take a digital x-ray and then it is showing on the screen for both the clinician and both the patient to see what the situation is, and that will help for better interpretation of the x-ray product, x-ray that is produced. So we have the digital x-rays, we have the panoramic imaging, which have largely replaced the traditional film production system that we used to have in x-rays, in dental x-rays. Okay, so this they allow real-time viewing, reduces exposure to radiation, and makes data sharing very easy. So we said that when you take a digital x-ray of a patient's any part of the teeth that you want to see, then that allows for real-time viewing, because you're taking the x-ray, it's displaying on the screen and you can see it, the patient can see it, and you can actually have a conversation with the patient. This is better than the previous way of sending the patient to go to the x-ray department or the x-ray unit to take x-ray. It is processed. Sometimes that will take another visit for that x-ray to be brought back to the clinician who will make the assessment. And if you work in very, very rural environment, then you see that it is very, very difficult to do that. Sometimes there are some clinics that may not even have the x-ray machines. They have to send someone for x-ray, and then however long it takes for you to get the x-ray, you come back to the clinic with the x-ray, and then that will be interpreted and taken care of and used for your diagnosis. But all of those processes can be eliminated using digital radiography and imaging system. Some types of digital radiography and imaging system include the intraoral sensors. These are they have high definition direct capture images. Okay, they can give you a high definition of images, and they can directly capture images for you. You have the panoramic system, which gives you the full jaw image in one sweep. Okay, in one sweep you can get a full jaw image of the panoramic. Using the panoramic system, you have the cephalometric imaging, which is used in orthodontics and surgical planning. Okay, so you have that cephalometric imaging that is used during orthodontic and surgical planning. You have the panoramic system that gives you the full view of the jaw of the patient in one sweep, and then you have the intraoral sensors that gives you very high definition direct capture of the image of the teeth that you are trying to look at. And then when we talk about that, you can see there are some advantages again to that, as well as some disadvantages to the use of digital imaging systems and radiography. And some of the advantages include that it gives you instant imaging with no chemical processing. Okay, so all the risk of doing some chemical processing will be completely eliminated once we engage in dental digital radiography and imaging systems. And also that it makes archiving those materials to be very, very easy, because you have soft copies of those images that you can actually archive. You can store it up in the cloud, and then anytime you need it, you can retrieve them, and you don't have to physically carry them. You can actually have those images in Nigeria have and then access them when you get to Uganda. All you need is a computer and access to the cloud. Once you get access to the cloud, you still pull the same image with the same quality without any distortion, and can still be able to use it as at when you want. It enhances diagnostic precision, so it helps you to be able to diagnose what the problem is with high level of precision against what it used to be when you had all of those processing and chemical involvement in the processing of the radiographs and all of that, which again is even harmful to the body. So there is this element of protection that you also have once you begin to use digital radiography and imaging systems. Now, but there are still some challenges that are associated with the use of digital radiography and imaging systems, which may include that it requires proper sensor placement for clarity. Okay, so again, we have talked about the need for people to retrain for these things. So you retrain, even though you are used to doing the traditional ones, there is need for you to upskill yourself so that you can be able to retrain, and this also comes with some cost as well. And there is high quality, the high quality units can be very, very costly. So to get very high quality digital imaging and radiographic equipment in your practice, whether in the dental laboratory or in the dental clinic, can be quite expensive. It's quite an expensive investment to make at the beginning of the time when you want to begin to incorporate those into your practice. Okay,